Although we are looking at a cow's knee, apart from the cow not having a fibula, the majority of the structures seen during the dissection are the same. Here we can see the femur, this being the medial side demonstrated by the head of the femur, which fits into the acetabulum of the hip, forming the hip joint. If we look at this more closely, you can see the ligament connecting the acetabulum to the head of the femur, which is the only ligament in the body with a blood supply passing through the middle of it to feed the head of the femur. Rupture of this ligament can lead to a vascular necrosis of the femoral head, with consequent bone death and potential osteoarthritic changes. Taking a slice with a scapula can show the articulating or hyaline cartilage covering the bone. On slicing through the cartilage, you can see it is a very thin structure, but gives strong protection to the underlying bone. This protection can be demonstrated by tapping the bone with the cartilage intact, and tapping it over the area with the slice removed, you can hear the difference. The joint is covered by a capsule containing synovial membrane, which secretes synovial fluid to give lubrication to the joint. Here you can see the yellowish fluid on the end of the finger. On removing the patella, you can see that the back is protected by hyaline cartilage, which is slightly thicker than that found over the ends of bone. Again, by removing a slice of cartilage, you can hear the difference between the protected and unprotected areas. The patella glides between the femoral condyles on extension and flexion of the knee, and any maltracking will lead to friction and retropatellar problems. The other aspect of the knee we need to look at is its stability. Stability depends on the joint ligaments, the collateral ligaments on the sides and the cruciate ligaments on the inside. When the collaterals are patent, there is no movement in a sideways direction. Looking at the individual ligaments, you can see by removing a ligament, the structure shows a flat, strap-like avascular tissue. You can now see by putting a side stretch to the joint with the ligament cut, there is instability with the joint opening up on movement. On removing some of the internal tissues, we can expose the cruciate ligaments. The anterior cruciate seen between the tibial plateau, moving back to the posterior intercondylar notch. On exposing the back of the joint, we can see the posterior cruciate ligament between the tibial plateau and leading forwards to the anterior intercondylar notch. If you try and move the joint backwards and forwards, the cruciates prevent movement, and if you try and hyperextend the knee, there is no movement. However, on cutting the ligaments, you will see anterior and posterior instability. By representing a rupture by cutting the posterior cruciate, you can see that the tibia moves backwards on the femur, giving gross instability. Cutting the anterior cruciate, the instability presents with a forward movement of the tibia in relation to the femur. Here is a clear view of the synovial membrane, which produces synovial fluid, as we saw earlier, the fluid giving the joint protective lubrication. On looking at the top of the tibial plateau, you can see the C-shaped menisci, which gives protection to the joint. This extra cartilage gives added protection and shock absorption to the major weight-bearing joint. On removing a meniscus, you can see the underlying protective hyaline cartilage on one side, with the intact C-shaped meniscus on the other. Damage and removal of these will soon lead to osteoarthritic changes.